Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Cecil Pineda. He's a healthcare executive, and we're going to talk about the Kevin MD article, Under Siege, the escalating ransomware crisis in healthcare. Cecil, welcome to the show.
Oh, thank you for inviting me, Kevin. Very happy to be here.
All right, so ransomware, that's something that has been affecting many healthcare systems over the years, and the threat is only getting worse. Just tell me a little bit about the context before we talk about your article and the danger that it poses to our healthcare systems. Let's give us some context.
Yeah, it's very disruptive, obviously. If you've been reading the news, maybe 7 or 8 out of 10 Americans have been affected in some way in the last, year. And it is one of those things that every cybersecurity guys, every, healthcare executives are very concerned right now. This is not something that's top of mind today. It's the hottest topic. We talk about it every day in the boardrooms, down to the daily calls. I just came out of my daily call today, and probably the word ransomware was mentioned 5, 6 times.
All right. So give us a little bit about your background and your experience with ransomware.
Yeah, been dealing with it for many years now. I'm currently a CISO of a company called R1 RCM. Not many organizations are very familiar with with our company, but we work behind the scenes with many healthcare organization, health systems. I lead our cybersecurity team and program. We have a large team of 100 plus folks dealing with cybersecurity threats, particularly ransomware most lately. My first encounter with ransomware was probably 5, 6 years ago, and I was a CIS of W International Airport, and the impact back then were very minimal, smaller scale. And probably if you remember 5, 6 years ago, the ransom was like $300, $400.
Yeah.
Now it's in the millions of dollars now. So I always joke with my peers that, oh, we're gonna catch up eventually. It doesn't look like the the bad guys are a step ahead for the most part.
So before talking directly about your Kevin MD article, just to bring everyone to the same page, in the healthcare setting, tell us what exactly is ransomware.
Ransomware is a type of malware that you get in various ways. Yeah, it could be as simple as an email, phishing to click a link. Most people just, if you click a link, they think it's harmless. Folks don't realize behind the scenes, it's doing its damage. It's trying to take control of your machine, your operating system. In many cases, in most cases, actually, it encrypts your data. And today, the latest ransomware are actually exfiltrating the data and then encrypts your data. So they take your data, they get your machine or your organization's servers hostage by, hey, we got your data. Do you want us to give it back or to, most of the time they'll threaten organizations of publishing the, sensitive data, in exchange of ransom payment. As I mentioned earlier, used to be few $100s. Now they've stepped up their game because they're stealing more data now, and they're asking for millions of dollars.
Now, of course, there's been some well publicized cases in healthcare, specifically Change Healthcare. What about healthcare institutions makes them attractive to be targets?
Probably number one is the volume of sensitive information we keep that we don't want the public to know. And I think the second one, which is really critical, is when you deal with patient information, you deal with patient safety. And there's the component of urgency. Many hospitals, healthcare organizations need to be operating. When you're in a ransomware situation, you are not able to operate. You have to, you have surgeries that are really critical to your care. You won't be able to because you couldn't get lab results. You could get the
Mm.
patient history, health history. So I think the the patient safety is a critical element there, Kevin.
And in general, who are the groups that are targeting these healthcare systems for ransomware?
There's a lot, mostly from Eastern European, Russian, but they're really everywhere. The most common ones are from Russia, and you probably heard many of them, Black Cat, and there's like two, three dozens of these actors that are operating, and some of them are creating affiliates. Some of them are branching out, and they're everywhere.
So tell us more about the Kevin MD article. Maybe give us some specific famous healthcare ransomware cases and what happened with those cases.
Well, there's last year we don't have a shortage. If you really just Google those ransomware, there's at least 12, 13 high profile or healthcare organizations who have lost millions. I think Change updated their announcement from 100 million PHI to 190 million PHI now. In my article, I actually said that the cost is $1 billion. Before this session, I actually did a little bit of research. They've increased they're almost $2.5 billion now
Wow.
and it's very disruptive. I could share to you, Change is probably the most common one that I can use right now. And the moment I got that phone call from Change, and it was it was managed chaos because we have to start disconnecting systems, making sure that we're not impacted. It's a matter of, every second counts because once you know, that we there's a term in our industry called indicators of compromise. Once those IOCs cross over to our environment, it's gonna be too late. So our objective on the first hour is to make sure that we're completely disconnected and there's no indicators of compromise that crossed over to our environment. It is very disruptive. You basically have to stop operating. Organizations start segregating inside Change. Once that happened, they started segregating or segmenting their environment so they could isolate the problem.
Mhm.
They start looking at the blast radius every hour. They start expanding that, and like us at R1, in the first few hours of that incident, we look at the bigger blast radius. Even those systems that are not directly connected to Change, we had to make sure that we don't have those threats in our environment.
And in the majority of these malware cases, these ransomware cases, is it simply just an employee clicking on a phishing email, clicking on a link? Like, how simple is it to become under threat from ransomware?
Oh, there's so many. There's probably 100 ways, Kevin. It could be a simple, you're probably recipient of some weird SMS with a link, to
Hmm.
click on this. Few days ago, I've been getting a lot of, hey, you haven't paid your toll, and there's a link. It could be SMS. It could be sometimes it could be a website that's taken over by the bad guys. You think you're clicking something there, and you didn't realize you're clicking something that will initiate the ransomware process behind the scenes, and the all after a few minutes you'll know it because it will display a message, or it will basically render the machine useless when you get infected.
So, if a healthcare system is under threat from ransomware, one of their employees clicked a phishing link or whatever, and now you mentioned the term blast radius, it's spreading throughout the system. In general, how successful are companies like yours, cybersecurity responses in terms of containing the ransomware? Is it effective, or do health systems end up paying the ransom?
Well, for the most part, a lot of us are successful because you don't, we see a lot of victims, but you also see a lot of organizations that are surviving. I think the very key to that is these layers of defenses. We often joke inside, in my team that it should survive the first click. We should survive, the, first hit. So I think the very key for healthcare cybersecurity executives are creating these layers of defenses. I think one is not enough. In today's world, you have to have two, three, or even four layers if you can afford it.
And give us examples when you say different layers of defenses. What exactly do we mean by that?
For example, you click a link, potentially malicious. But before that, your email security should be able to, we call it sandboxing, or isolate that. It should be able to inspect that link before it even gets to you. Most organizations block 99.99% of these malicious links, by the way, or attachments. However, that small percentage that we see, it should be able, your email security should be able to analyze it. Remember, we have a term in cybersecurity called 0 days. 0 days are threats that we did not know before, that are that our tools cannot detect. Those 0 days, they will evade all the security tools that we have. However, there's a lot of advanced tools that looks at using AI to look at behavior. It looks at the behavior of that website or that link, and if it leads to a malicious website, it will block it. Now, that's the first layer level of defense. Now, when you click this link, there should be another tool that detects for malware. You've heard of products like Sentinel-1, CrowdStrike, Microsoft Defender. Those are what we used to call them antivirus, but they're more than an antivirus today. They are really advanced malware protection tools. If that layer fails, most likely that second layer is very good, by the way. It blocks a lot of them. Then there's this really, really advanced threats that could evade those two layers. If it's a website, then you have another tool that actually watches for malicious websites. Before you even land on this page, it will block it. Hey, this website is malicious. It may contain malware. So in most organizations, those three layers exist today. In some, you can add a fourth or a fifth layer, but it gets very expensive, as you add more layers.
Take me through the thought process whenever a health organization is thinking about paying the ransom. What goes into that decision-making process in terms of whether to pay the ransom or not? Take us behind the scenes.
Yeah, you know, even before an event, that's something that should have been decided before by not just the cybersecurity leader, but it's really more about the business leadership of that organization. Majority of the organizations I know, they made a decision before anything will happen, not to pay. However, things change when you're in the situation where patient safety, patient information is involved. And in some cases, your backup data may not be available or, impacted as well. Those three things are really key decision points. If they don't have sufficient backups, organizations are likely to pay ransom. If the data is being threatened to be published, that is going to be another critical decision element that business leaders need to consider. And sometimes, the urgency of patient safety, you have patients that are waiting in ER, or on the operating rooms that needs immediate care. So those are really, we practice so many incident response tabletops. Those exercises, 99% they go really well. However, in a real incident, you don't have the element of that stress, that
Hmm.
time pressure. You don't have all those. And the bad guys also they give you a time limit. Hey, if you don't pay by this time, we will publish the data. So it's really difficult when that time comes. Business leaders, cybersecurity leaders need to sit together, including, I think the most important one is also our chief legal officers in organization. They need to sit down and assess what is the best, you know, path forward.
Now, in general, what percentage of these ransomware attacks are successful? Or, in other words, what percentage of these cases actually get paid their ransom?
So far, majority. I've heard colleagues and friends, majority actually went through, the change was one of the unique ones. They didn't get what they paid for, but majority of organizations that I heard that they were able to get the decryption keys, get their data back. However, there's always saying, it's hard to trust the bad guys.
So you're saying the majority paid the ransom and got their data back, or the majority mitigated
Well,
the
though
threat without paying the ransom?
majority of those who paid got their data back and
Okay.
a lot of organizations today, even though we see a lot of companies they fall victims to ransomware, there's a lot of organizations that actually avoid, they're able to, because of those layers of defenses they've implemented. We see them every day. Most organizations, Kevin, like the size of R1, like the size of large health systems, they get billions, not millions, billions of
Wow.
attacks on any given week.
Now, do you feel with all this publicity on cybersecurity, healthcare organizations are properly prepared for the majority of threats, or do you feel like there's still much more room to improve?
There's room to improve. We're kind of, I'm just generalizing the entire healthcare industry. I'm gonna quote a good friend of mine who works at another health system that the majority of healthcare industry is quite behind on these proactive controls against ransomware. But the last couple of years, especially last year, it's a big wake up call for many of us. This has gotten the attention of executives. It's no longer a cybersecurity problem. It's a business problem.
What about those private practice physicians? Maybe they don't work for a large corporation and they don't have the budget for proactive cybersecurity. What kind of advice do you have for smaller mom and pop practices that aren't part of larger organizations?
Yeah, I've been asked. One of my neighbor runs a series of dental clinics, and they couldn't afford the tools that we're running today.
Yeah.
There are some commercial tools that are available today. They're not the best, but they're sufficient. But I always tell them the most important thing is, of course, still preventive, making sure that they have the right, at least the basic tools. But I always tell them two things. Number one, you need to have daily backups.
Hmm.
If something happens today, at least you have the backups from yesterday. They should be separated from the network. They should be, tested for recovery. You have to test those backups because even if you back up every day, but you don't test how to restore the data, they're useless. And second is actually being able to operate when your systems are down. I know it's going to be hard to use paper and pen or maybe Google Sheets or, online, file sharing. It's one of those things you have to be prepared when your systems are down. We're guilty of over reliance on technology, Kevin. Like here at home, when the internet is down, I get there, it's almost like the end of the world. And my kids will complain. It's like, you know, it's the end of the world. But for practitioners, for small practice, I think getting ready using alternative methods for a few days, you'll eventually recover, but it's going to take a day or two for small practice. For large organization, it takes weeks.
Mm.
You have to make sure that you're ready to have a secondary way of doing things without the use of those common systems that you use. I want to add, Kevin, 2 months ago, I spoke with at another event with an ER doctor. I presented the cyber side, and she presented what's happening in the ER when systems are not available. And I was so happy that I spoke with her because I learned what's happening on the ER side when systems are down. They have to do all these things manually. However, they're also limited because like lab results, they
Hmm.
couldn't get lab results because systems are down. So
We're talking to Cecil Pineda. He's a healthcare executive, and KevinMD article is Under Siege, the Escalating Ransomware Crisis in Healthcare. Cecil, you've been very, very helpful, very insightful. Let's end with some take home messages that you want to leave with the KevinMD audience.
leave something, preparedness. I think just we just need to prepare. I think it's important for not just the cybersecurity leaders, but business leaders too. It's not a matter of if, it's a matter of when. So invest in basic security tools and prepare for make backups and prepare. If something happens, you're ready to tackle it head on.
Cecil, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you, Kevin.